Excellent. Well, first of all, thank you for putting this on, all of you for attending today. I wish you all health in these troubling times. MedHab was formed actually in 2008 when we started this journey of remote technology. It was really based on a knee injury that I had just from years and years of sports. But we have two technologies that are available for providers today for remote physical therapy. Quite frankly, one is StepRight. Think of an insole, just like a Dr. Scholl's that you would see in the store, with the exception all the technology that we have is resonant within the insole. And the device allows a physical therapist or a doctor to remotely monitor patients by way of prescribing rehabilitative protocols, which range from gait analysis, range of motion analysis, force distribution. There's 140 different American Physical Therapy Association exercises that are embedded into the system. The technology is called StepRight, STEPRITE. And you can visit www.medhab, which is medhab.com for more information on it. But again, it's a pair of insoles. Your physical therapist, for example, could prescribe a rehabilitative therapy, whether it's TKA, some low back injury, any type of lower extremity injury. You could set a rehabilitative protocol. You can customize it to meet the patient's needs. You're able to see via the dashboard reports their gait analysis, if they're heel to toe striking, if they're moving from supination to pronation. Everything is time stamped. Our force distribution dashboards show symmetry or lack thereof, left to right, as well as within the quadrants of the foot. So again, you know, based on what the patient's doing, if they are standing behind the ankle, or on the ball of the foot, if they're supinating or pronating. It even shows line graphs, the two limbs. Hopefully, as they get better, you see these line graphs start to merge. The third dashboard that's available for managing your patient is a range of motion dashboard. You may have something like we'll just say a knee extension exercise, right? It shows again the degrees of motion day to day and over time. It shows compliance if the patient is able to do what you're asking them to do, which obviously is the most important thing when they're not in front of you. The technology can actually be used pre and post-operatively to manage your patients. And I think at a time right now, pre-operative would be very apropos to use. For the patient, it's simple. All the patient does is register the account online on medhab.com. They download the app. And when you as the provider input the protocol and prescribe the device to the patient, whatever you put in there, whether you want them to do their exercises twice daily, 10 repetitions, 2-second hold times, and any number of exercises, it's all there in the app. When they pair and connect, they just click the app and it turns on. And they just follow the instructions. It's audible, it's textual, and there's even a 3D animated image that goes through the exercises in the exact order and in synchronization with what you want. So there's no flailing of the limbs. They're doing this very, very to the degree that you want them to make these exercises, just like a virtual physical therapist would be there. In addition to the daily reports that could be used by either you or a physical therapist, we also send weekly and monthly reports directly to the doctor for purposes of remote patient monitoring. Those are compliance reports, gait reports, and force distribution reports, so that anybody within your office per remote patient monitoring can make phone calls and engage your patients to make sure that they're doing what they need to do and they're meeting the tolerance that you would like. I would like to offer as well that the technology, because of COVID-19, we have now just embedded some characteristics, and we supply a pulse oximeter. So now the pulse oximeter, with that, you can do the patient will enter at the beginning and at the end of their therapy, their heart rate and oxygen saturation, which may help you look at some pulmonary issues up to and including the potential for COVID-19. But important to that too is, pulse oximetry is one of the qualifiers for remote patient monitoring. So it's embedded in the system, so you are able to manage your patient not just during the acute episode of physical therapy, but ongoingly throughout the year, and earn reasonable reimbursements that will be discussed shortly. The sister product to StepRite is called MyNotify, and it was initially designed as a fall detection device, and it can be worn on either wrist or either ankle. And we have engineered it with 40 different American Physical Therapy Association exercises, as well as what's called Otago exercises, which are strengthening exercises for mitigating falls up to 35%. It too is app driven, works very similarly to StepRite, excuse me, and it shows different range of motion exercises. It shows the speed of those exercises in milliseconds. It shows the repetitions and the degrees, all of which you or your physical therapist can manage that patient remotely to see everything that's going on. Again, for the patient, it's simple. They just click on the exercise and they perform it. Very simple to register. You could actually call for more information. We have technicians ready to answer any questions or support you at 800-541-1420. The process is simple. You would just register the count, or your physical therapy would register their count. It goes with the NPI. We check with CMS to make sure that the provider is in good standing. It takes about 24 hours. And then from there, you're ready to navigate the system, prescribe MyNotify to your patients, and set the rehabilitative protocols for either StepRite or MyNotify. Again, that is 1-800-541-1420. You can also get more information by visiting www.medhab.com. So in close, what it offers is the 3D tracking, pressure sensing, quick-time wireless communication. It's HIPAA secured, FCC regulated, and certified. And the devices are Class 2 and Class 1 exempt devices, respectively. So barring any questions, I'll turn it back over to Robin at this time.